Hello everyone, thanks for tuning in. My name is Christy Ciesla and I am a doctor of physical therapy and I have a board certification in pelvic rehabilitation. So that's a mouthful, right? So I want to kind of introduce you to what pelvic rehab is and how we work and the ways that we help our patients. And I also want to be able to give you some education that you can use right now to help you with any symptoms that you may have. And then maybe kind of introduce you to our field so then when you're able and ready to come into therapy, you might want to access our care someday. And that could be the care of me or my colleagues or any other pelvic therapist. It's a wonderful, wonderful field. So just kind of give you a little bit of a background. So what is pelvic rehab? Pelvic rehab is a very specialized field of physical therapy that deals with things that you wouldn't normally associate with physical therapy. So we treat things such as urinary incontinence, pelvic pain, sexual dysfunction. I always say when people ask me what I do pee, poop, pain, and sex, okay? Some of the diagnoses we may see are, like I just said, incontinence, but also bowel issues like constipation and involuntary loss of feces. We also treat patients who have had surgery or have gone through any kind of cancer treatments like radiation or hormone changes because of those cancer treatments. And then, abdominal surgeries like hysterectomies or C-sections or any kind of cancer-related surgeries that may be associated with colon cancer or rectal cancer or anal cancer. We are seeing a lot of patients in cancer-related diagnoses, but we also treat patients from the age of 18 all the way through the lifespan. So we are treating women who have had babies, and we're rehabbing them after those babies because they do wreak havoc on our bodies. We are seeing patients who have trauma or injury. So if there's any kind of injuries to the lower back, spine, pelvis, or hips that cause pain in areas that most physical therapists don't really know how to address, such as the vulva or the vagina or the rectum. Sometimes women have pain in the buttocks area and nobody really knows where it's coming from. So we generally can find those things. We're really good at figuring out what's causing that. So sometimes the treatment involves treatment to the pelvic floor muscles. So a lot of you may have heard the term Kegel. Most women have heard this term, and that term is an exercise for those muscles that was designed by Dr. Arnold Kegel, who taught women how to strengthen those muscles to combat things like urinary incontinence. Unfortunately, things have changed over the years, and we have learned that Kegels are not always appropriate for a lot of diagnoses. So if you have involuntary loss of urine, sometimes those exercises can actually make it worse if the muscles tend to be a little bit too tight, because a tight muscle doesn't always mean a strong muscle. A tight muscle can be a weak muscle. And we'll talk about that in a second. So we're not Kegel doctors. We carefully evaluate the muscles and we determine the appropriate plan of care based on the findings that we find in the treatment room. So the other thing that I like to point out about what we do that I think is really important is, and I think this is the thing that a lot of patients need to be educated on, so you can then educate your physician, nurse practitioner, and physician assistant providers who provide us the referrals, is that when we're in the treatment room, we are trained to differentially diagnose. So what I mean by that is if you have a symptom such as involuntary loss of urine or something like that, and you go to your doctor and you say, I really need to address this, this is a major issue, and the doctor says, well, we can do this test and we can do this test and we can do this test. If you suggest pelvic therapy first, a lot of times you're going to get a treatment session or an evaluation with a therapist who can determine whether or not this is a musculoskeletal or neuromuscular condition or whether or not you're going to need further testing, and we can send you back to the doctor for that, because it's a very conservative type of care. So you really can't lose with it. Most people have some sort of pelvic dysfunction, especially if any of us have ever carried a baby. Those babies wreak havoc on our bodies in many, many ways. So we can always fix something, usually when you come to see us. And so when we're in the room with our patients, and I try to tell when I do education with my physician providers and I'm teaching them what we do, oftentimes I will say that we are one of the only medical professionals that you see on a regular basis. So generally, you'll come and see us once a week for anywhere between 45 minutes and an hour and a half, and we spend time in a private room with you discussing all of your most intimate concerns, and we have our hands on you. And so that's a very different type of service. So if something changes over those periods of weeks or months that you're seeing us, we can usually recognize them. So it's a nice bridge after any kind of cancer treatment. Because a lot of times what I hear from my patients who are cancer survivors is that they go through all these treatments and they're seeing doctors and they have all these people surrounding them all the time in the medical field. And then after the treatment's over, everything ends and they don't know what to do. And so it's nice to be able to have someone to kind of follow and then wean off of that care. So a lot of patients will see me after their cancer treatments, or even sometimes during, to kind of help mitigate some of the symptoms of that. So now I want to move on to a little bit of an anatomy lesson so you can understand what types of things can go wrong with the pelvic floor based on the functions of the pelvic floor. And then from there, we'll do another video for bladder health and bowel health and sexual function that might be able to help you with some other issues. So as you can see here, I have a pelvic model. It's a female pelvic model. So what you need to know is that the pelvis is made up of three main bones. We have these two innominate bones here and here, and then those bones attach to the sacrum, which is that scoop-shaped bone at the bottom of the spine, here and here at the sacroiliac joints. A lot of people will have pain in these joints during pregnancy, or even just later in life they have dysfunction and they think it's their hips because that pain will radiate into the buttocks a little bit, and it actually oftentimes is a sacroiliac joint problem. The sacrum, or that scoop-shaped bone, extends down to the coccyx or the tailbone, and you can see that right here. So that tailbone is surrounded by this group of muscles, and you can see how these muscles sling from all the way to that back of that tailbone to all the way to that pubic symphysis in the front. So front to back and then side to side between those two bones that you're sitting on. So if you're sitting down, you're sitting, let's see if you can see that, on that pelvis, okay? So you can see how the pelvis, the bottom of the pelvis is formed by those muscles. The bottom and the sides of the pelvis. There's also another hip rotator muscle where you can see one of my fingers that goes across and forms the back of that pelvic floor. So it's really a true bowl or a basin. And the bottom of that basin is very, very important in function. You can see how these muscles have multiple layers. So we have a very superficial layer, and then we have a deeper layer. There's also another layer inside and between there that's really important. So we take that into account when in regards to function. So let's talk about what the pelvic floor does. There are four main functions. The first is that those muscles support. So we call this the 4 S's. So these muscles, I always say, are like a car idling. They're always working to support the pelvic organs. So inside that pelvis, what am I talking about? Sit your bladder, your uterus, your ovaries, your urethra, and your rectum. And so those muscles have to be working to be able to provide that support. In addition to those muscles, there are different layers of connective tissue or that kind of hold those organs exactly where they're supposed to be. So just the simple act, so what compromises that support? Well, just the simple act of carrying a baby can compromise that support. So think about how heavy those babies are, just putting that pressure down there. So even if you've had a C-section, you could have supportive dysfunction. Other things that can compromise that support is pushing a baby through these muscles, right? The babies damage and injure these muscles. They tear these muscles. Episiotomies cut these muscles. And so when a muscle is torn or injured, it doesn't just return back to function. Many times, women don't even think about it, and they go through 20, 30, 40 years fine after childbirth, but the injury to that muscle starts to rear its ugly head later in life. And we can talk about that a little bit more in a second. So support is often compromised. Another thing that can compromise support is chronic constipation. So if you're always pushing and bearing down to try to get a bowel movement out, you can stretch and compromise the support at the bottom of that basin, okay? So it's really important that we try to maintain good support in these structures. And you've heard about some of the diagnoses that might be associated with a compromised support system is a cystocele or a rectocele, where your bladder or your rectum start to drop down into the vaginal canal. Any kind of prolapse can be related to a supportive dysfunction. The next thing these muscles do is they surround the urethra, and you can see very clearly here how they surround the anus, okay? These muscles, because they surround these openings, are considered sphincters. So in the pelvic floor, these sphincters are like valves, and those valves need to stay closed most of the time so we don't pee and poop everywhere. But just as importantly, they need to be able to open to allow us to eliminate completely. And the pelvic floor can have dysfunction in both of those areas, and sometimes it can have dysfunction in both of those areas at the same time. So what I mean by that is you could be leaking urine and have a muscle that can't relax either at the same time, because a muscle can be both tight and weak. And that's why it's really important to see us to be evaluated if you are not noticing a change or an improvement in your symptoms after doing Kegel exercises for a week or two. Okay, so, and they can actually make the symptoms worse. So we have support and sphincter dysfunction. When there's sphincter dysfunction, we see diagnoses such as urinary and fecal incontinence, because the sphincter can't close enough and you can lose urine and feces. But also we see diagnoses such as constipation and urinary retention, inability to relax the sphincters to allow us to empty completely. The next thing that these muscles do is they have a sexual function. So the sexual function of the pelvic floor is that they aid in sexual appreciation and orgasm. So you can see right here, this is right around where the clitoris would be. And these muscles come up right next to it, okay? And they have attachments at the clitoris. So during any kind of orgasm or climax, these muscles are contracting and they're working to stimulate the clitoris as well. The other sexual function of the pelvic floor is that these muscles need to be able to expand enough to accommodate penetrative intercourse of any kind. So if you are having discomfort or pain with intercourse, there are several reasons why that could be, and many times it's associated with shortening or limitations in that pelvic floor. And that can change as life goes on, whether it's because you're holding tension there, or you have a back problem that's causing those muscles to spasm, or because you've lost estrogen and the tissue isn't just stretching as well, it's not moving as well because it's less, it's a little bit more friable or dry. So we can address that in pelvic physical therapy through a variety of ways. And then the last function of the pelvic floor, which is near and dear to the pelvic PT's heart, and it actually kind of goes in line with everything that we just talked about, is that these muscles are stabilizers. So you can see how they kind of hold the pelvis together from the bottom, right? But the other thing that is really interesting to note is that not only are they stabilizers from the bottom, but they actually have connections. You can see how this muscle kind of comes up through here to the deep abdominal muscles, your breathing diaphragm, and your back muscles. So I always tell people to think about, I don't know if you're going to be able to see this, but you think about your body, your thorax, as a canister, okay? So the bottom of the canister is the pelvic floor, and the top of it is your diaphragm, okay? The front and the sides are formed by those deep abdominal muscles, and then the back is formed by your back muscles. So if you think of the canister as like a can, there's actually a normal amount of mobility that occurs as we're breathing throughout the day that we don't even know, that we're not even aware of, okay? So when we breathe in, I'll stand it back up again, our respiratory diaphragm drops down, our abdomen expands, so it's like this, okay? And our pelvic floor drops down as well. And as we breathe out, they come back in. So respiration looks like this. And I'm exaggerating, but what's happening inside this cavity, this canister, is that all of our organs are moving in conjunction with our breath. There's a normal mobility that's occurring 20 to 24,000 times a day as we're breathing. And so when that canister activity is disrupted in any way, it causes dysfunction in the pelvic area. And so sometimes that's because our abdominal wall is really tight. We're holding a lot of tension, or maybe you spent your whole life trying to look thinner and you're tensing up your stomach and you're pulling it in all the time, and then you don't know how to relax it and breathe normally. Maybe it's anxiety and tension because you've always held a lot of tension in that area. Any area of the canister can cause that, including your buttocks muscles, your abdominal muscles, your back muscles. And so you're not getting that full mobility. Any kind of scar tissue in any part of the canister, so whether it's from childbirth in your pelvic floor, or childbirth via C-section, or any cancer-related surgeries, hysterectomies, and things like that, can disrupt the activity of the canister and then result in dysfunction in pee, poop, pain, or sex. And so we can help to mitigate those symptoms by restoring some of that activity. And one way that you can do that is through learning proper breathing techniques. And so oftentimes we teach that in our treatment room on the first day. So it's starting to teach you how to engage and move that canister in the proper way. So if any of you have ever done yoga, sometimes they go into that breathing in detail. Other times I've been to a yoga class and they don't really talk about it. But basically what it is called diaphragmatic breathing. So if you go to Google and you Google breathing techniques, there's usually a YouTube video or like a relaxation breathing, pelvic relaxation breathing. It will bring you to a video by Fem Fusion that will actually go through a 10 to 12 minute guided meditation that brings you into that breathing and helps you to be able to feel that mobility in the canister. So it's a really nice thing to be able to do. And then, you can put one hand on your belly and you can feel that movement that occurs in natural, normal relaxation breath, or a natural, normal breath. And then you can actually exaggerate that and expand on that and try to get that mobility in the canister. And that's one way to start to improve symptoms. The other thing that it does is it actually is one of the only ways that we can regulate and calm our autonomic nervous system, especially in times of stress like this in our country. People are losing jobs. We're all very scared about being sick and our loved ones becoming sick and ill. We tend to not take care of ourselves as well when we're not sleeping and we're anxious, and we may even be exercising less because we're so tired from being so stressed. This is a great way to reset your nervous system. By engaging in some nice meditation and relaxation breathing, you can actually override that response of your central nervous system by changing the activity of your breath. It's one of the only areas in the autonomic nervous system that you can control. So I think that's all I wanted to cover for this first class. It's a lot. So take that in. Try to think about your pelvic floor and your pelvis and why it's important. Remember, everything attaches to that pelvis, so it's an extremely important structure. And then for our next session, we're going to talk about bladder health, and we'll move on from there. Thanks for listening.